have you been diagnosed with sleep apnea and given only CPAP as a way to treat it? Would you like to hear about another way to treat sleep apnea? Well, that's what I want to talk about today. I'm Dr. Durst, and welcome back to the channel. I am a physician that specializes in regenerative medicine with a focus on sexual wellness, but today we're going to talk about sleep apnea and a secret way. It shouldn't be a secret, but it is not a commonly used treatment form for sleep apnea. So what is sleep apnea? So if you are sleeping and you have a period of time where you stop breathing, that's sleep apnea. And so frequently, patients have some symptoms. They're tired the next day, they're gaining weight, even some increased health problems. But also if they have a significant other, frequently that significant other is noticing that they stop breathing, they're gasping in the middle of the night, and that would be a sign of sleep apnea. Is all snoring sleep apnea? And that's a no. Not everyone that has sleep apnea snores. And so if you're snoring, it doesn't absolutely equate to you having sleep apnea. But snoring can also affect relationships, especially if it's too loud and somebody else can't sleep beside you. So this is one of those treatments that you can use for snoring as well. But as far as sleep apnea, that's the one that is the hidden epidemic. There is an estimated up to 80% of people that actually have sleep apnea and don't really know about it. They go undiagnosed, and that can lead to significant health problems. So if you have sleep apnea and it's untreated, then it increases the risk of lots of different things. And so you have about 5 times the increased risk of heart disease if you have sleep apnea. So it needs to be treated. Stroke, about 3 times more likely to have a stroke if you have sleep apnea. And obesity is a huge issue because while losing weight might not necessarily result in sleep apnea resolution because you already have some laxity of the posterior pharynx or the back of the throat, that isn't going to tighten up just because you've lost weight, but you can't lose weight if you don't treat sleep apnea. So if there's obesity there and you're kind of stuck and you're trying and you're doing all the right things, just know that if there's untreated sleep apnea, you won't lose weight. So some of the studies that have looked at this, 1988, there was an NIH study that was the first time that they were actually tracking the incidence of sleep apnea and its prevalence. And that's we figured out that there were so many health consequences to sleep apnea being untreated, but also just the fact that lots of it was undiagnosed. And then there was a Wisconsin cohort study, a 20-year study, 1,500 adults aged 30 to 60, and they found that about 25% of men and 9% of women had sleep apnea. And so it is more common in men than in women. And there was a Swedish study as well, 64% of men and 25% of women. So a lot more common in men. But then if they had an apnea hypoxia index score, which is an AHI score of greater than 30, they were 3 times more likely to die within the next, I think it was 5-year period. And that was the Wisconsin cohort study. So there's a significant health consequence to having sleep apnea undiagnosed or untreated. So it is important that if you're diagnosed that you actually are treated for it. But a lot of people don't want to go through the sleep study and stay overnight to have a sleep test. But it's important to have that diagnosis. There are some ways to diagnose it with a home kit. And because a lot of people, their jobs are like truck drivers, for instance, if they have sleep apnea, they're falling asleep at the wheel, that can put them at risk for keeping their job if they're diagnosed. So a lot of people will kind of avoid that diagnosis because it has job implications with it. But it costs us about $150 billion annually related to healthcare, related to accidents, loss of productivity, just related to sleep apnea. So it's a huge epidemic that is undiagnosed, untreated, but the treatment options aren't great. And there's implications for your job if you are diagnosed. So the typical treatment is a CPAP machine, which is a big machine that you put on. So if you had trouble sleeping before, try putting on a big machine that makes a lot of noise and then sleeping well. But it does keep the airway open, and so you don't stop breathing and your oxygen level doesn't drop. And so that's where Again, if you're trying to lose weight, you have to treat it to lose weight. You have to prevent those medical conditions that end up happening if you don't treat it. So that's the gold standard for a treatment option. They actually can do a vagus nerve surgical procedure where they put a vagus nerve stimulator in, and that's a treatment for it too. But again, that's an Inspire therapy. And they can do surgery to do a uvuloplasty because you really have either a laxed area in the back of the throat and that pointed piece that comes down in the back of the throat, and they can actually potentially reduce the size in that. But ultimately, what I want to talk to you about is that there is a laser treatment called night lace that is done with a laser we have. We actually have two of them called Photona. So it's the Photona Dynamis Pro, but it does a laser treatment, and we can laser inside of the mouth. And then we use that laser light energy in the back of the throat to hit that tissue, stimulate it. It's completely comfortable. There's no contraindications. If you can open your mouth, you can get this procedure done. And then we actually sometimes will go underneath the tongue for a more advanced treatment. We're just tightening up that area in the mouth that is causing issues that are making your throat more laxed and causing you to stop breathing and obstructing your airway when you're sleeping. And so this treatment in the back of the mouth, 20 to 30 minute treatment max. Super comfortable. If you can open your mouth, you can have it done. It stimulates collagen elastin because we're heating that tissue till it's injured, so we're tightening it up. We're going to see it shrink. And the nice thing about it is that area, being mucosa, does respond very well and very quickly to laser treatments. Usually recommend at least a series of 5 to 6, usually 6, and almost complete, resolution of treatment that results in a correction of your sleep apnea. And again, you can actually do snoring tests. You can do that repeat sleep apnea test at home to see that now your AHI index scoring is now back to normal and not putting you at risk for cardiovascular disease, stroke, obesity, and metabolic disease, and insulin resistance, all of that. So this is absolutely an in-office procedure that isn't painful, that anyone can do. And if that gives you another option to the only other two, a potential treatment with a surgical device implanted in your chest, or a big machine that also doesn't, either one of those don't get to the root cause. This gets to the root cause. So it is worth seeking out a provider that does a night lace treatment. So we'll put a link in the description that talks about night lace and the machine that does it so that you can search for that in your area. But this is absolutely a treatment you need to check out because it is too risky to go untreated, and I just think it would be too difficult to sleep with a CPAP machine, and I would rather get the root cause and correct it so that I can prevent those issues, have no pain, no downtime, and not sleep with something overnight. So let me know what your thoughts are, if you've ever heard this, if anyone's ever tried it, and let's start a conversation in the comments. Let me know what you think. Willing to deep dive into anything sexual wellness and wellness. Thank you.